All right, everybody. Hello. Happy Wednesday. Happy Wellness Wednesday. We're excited to have our third wellness webinar tonight. We have Dr. Jacqueline Buckley, podiatrist extraordinaire and owner of Roca Foot and Ankle Centers here in Renton, Washington. We're just going to jump right into it because I know it's dinner time, evening time, and we're just so excited to have you on, Dr. Buckley. I wanted to let people know that you have been in the Seattle area practicing for some time, actually born and raised locally, went off and did your training in the East Coast, New Jersey, New York, but now back home and just rocking it out at Rocket Foot and Ankle Center. So I wanted to pass the mic off to you, so to speak, and have you share a little bit about yourself and your practice before we kind of get into talking about Foot Care 101.
Thank you, Doctor, for I appreciate you inviting me to be here to speak. I am Dr. Jacqueline Buckley, and I am a foot and ankle surgeon podiatrist here in the Renton, Washington area. I was born and raised in Kent, and so I'm homegrown, love Seattle, and I have been practicing in the area since 2012. And I just opened my own practice just a few months ago in the middle of this beautiful pandemic. And so here we are. And I am just thankful and blessed and excited to be here and talk to you guys about all things foot and ankle related that you want to know about.
Awesome. So we're just going to get right into it. All right. So can we talk about a little bit about what a podiatrist is? I mean, of course, I know what a podiatrist is, but I think a lot of people have no idea that you guys are surgeons. And so I thought you could share a little bit about what that training is like, what all the conditions you treat. Can we just kind of talk about that to kind of set the framework?
Sure can. So that's the number one question that I get is, what is a podiatrist and what do you do and why did you do it? Basically, why do you want to do this? And so I don't have a foot fetish. I just at all. Let's start with that. But I actually got into it when I took the MCAT, and there was all these different schools that were reaching out, and some of them were podiatry, and I was like, what is that? So I Googled it, everybody Googles things, and it felt like it was good for my lifestyle. I want to have kids, want to get married, and you can do surgery. There's all kinds of things that you can frame your practice to be. Some people think podiatry is just cutting toenails or prescribing orthotics, and that is far from the truth. There's so many things that you can do with foot and ankle. I am a surgeon, and so my specialty is foot and ankle. So a little bit of everything. People can come in with hammer toes, with bunions. They can come in with ankle fractures. It's very common. Foot fractures. All kinds of conditions of the lower extremity. And I'm not just limited to sports injuries. I treat children. The youngest person I treated was 6 hours old for clubfoot.
Wow.
So the mother and father knew in utero that the child had a clubfoot, and they really wanted to start having it treated once the child was born. And then my oldest patients are 106. So I have really a broad practice. I can see anyone. I had a 3-year-old yesterday, and I know some of my colleagues in medicine, some don't really want to treat young people. Some people don't want to treat older people, but I pretty much do a lot. So there's all kinds of things in between. So there's surgery. I subspecialize in wound care. So I see a lot of diabetic patients. Diabetic patients, though, are not the only people with wounds. A lot of people think that only diabetics get wounds. And there are wounds for other reasons, like vascular issues, traumatic injuries. And so I see it runs the gamut of my practice. And I see all kinds of people, athletes, weekend warriors, the older patients, our seasoned saints, our children. So there's all kinds of things that you can do in podiatry. So many things.
Love it, love it. And I'm a family physician, as you know.
Yeah.
Same thing, like all the way from, fresh out the womb we say from the womb to the tomb. Sounds like it's the same thing
Yes.
For you, but focus on the foot and ankle. So that's actually really, really awesome. We'll be sending people your way for sure. So let's just kind of get into how to go about doing a foot exam at home so you know when to see a podiatrist. Can we kind of talk about that?
We sure can. And also, another thing is people think that just because my specialty is the lower extremity, I went to school for 4 years. I have a medical degree. Some people don't think, they're like, do you? And then I did 3 years of residency. So I have done surgery on all parts of the body, from the
Okay.
top to the bottom.
Okay. Yeah.
So, and also too, we have to deal with mental health and all of those kinds of things because those are incorporated. But as far as the question you just asked me, you asked what are the things that I primarily see? I'm sorry.
Oh no, I was asking. So patients have a good idea of when they should come see you. What they should be what should they be looking for in a foot exam, so they kind of know, okay, these are the things this is a red flag when to come see you.
Oh, there's all kinds of things. People will, I mean, there's your most broad situation, which is, sometimes people do not feel. And so they're insensate, as we call it. They don't feel. And so sometimes people will have objects stuck in their foot and they don't know it until they try to take their shoe off. So those are your big things. But there's small things like people who have unilateral or bilateral. So one leg could be swollen. Sometimes both legs are swollen. Sometimes there could be something going on with the heart, their vascular system, their arteries aren't pumping out as much as they should. Their veins aren't bringing up the way that they should. So sometimes people will say, you know what, I swell in the summer. Should I come and see you? Or I stub my toe. It doesn't really look that good. It's been about 3 weeks. Should I come and see you? Or I have a new growth. And I tell people that really any kind of growth that's new to you and that is there, you should check it out. They should come see you to have it evaluated, depending on where, have it looked at. Some people will get new growth and they kind of let it go. So, and then there's, things like ingrowns. Some ingrowns are worse than others. So if you feel like you can't get it out yourself, or if you're causing yourself some very, very, very painful, situations that go on, come in and be seen. So there's a broad spectrum of why people come in to see me. Sometimes they wonder about if they run, what kind of shoes should they wear? We live in the beautiful Pacific Northwest. What kind of shoes should they wear hiking? Or then my toe fell off while my toenail fell off while I was hiking.
I got you.
And so what should I do? But I have had patients, unfortunately, whose toes have fallen off.
Oh my goodness. Yeah.
So
We'll get into some of the footwear choices for sure later on, but I sounds like to just kind of summarize, if there's loss of sensation in the foot, or the feet rather, right? If they're having swelling, if there's something that's a new growth, definitely, head to see a podiatrist, maybe start the discussion if you have a PCP, but definitely come see you, kind of safe to say.
And pain.
And pain, of course, definitely. So when they get to your office, what should they expect during a podiatry visit? Kind of what are kind of come in with a clean foot, come with you know what I mean? Like what should they expect?
First of all, you should expect to take your shoes and socks off. I know a lot of people who do not expect that. They really don't.
Right.
They really don't. They're like, I've been seeing, somebody else and they never looked at my feet. And I'm like, well, so please be ready for me to look at your feet and your ankles. I have to do an exam. Also too, I don't need you to take your pants off for the most part, generally.
Right.
Some people don't understand. They think that they do. But really just what I want you to have is just an open mind, understand that I do need you to take your shoes and socks off. And there's going to be times where I'm going to want you to walk. And I'm going to need that because I want to see your gait. And sometimes there's going to be some movements that are interesting. I'm going to want to lie you flat back. I want to see if your limbs are even. You could be telling your primary care, they could be coming in to tell you their back hurts. And so there's different things that I'm going to be looking for in the lower extremity to see if that contributes to the back pain. So just be open to just having me evaluate you. I want to see what's going on with you, and don't think that it's just going to be limited to the feet and the ankles. There's sometimes things that are going on above that I'm going to need to take a look at.
Gotcha. Wonderful. So I was going to ask you about 3 common conditions that you treat, but we'll get to that. But I thought it'd be fun, since summer is literally this weekend. This Sunday, it's officially summer season, and toes will be out, and flip flops and other things. And I was looking at your Instagram yesterday, and you had a great post on like summer foot care. So I thought you could let people know kind of some good basic summer foot care tips.
The biggest question in the summer is, what kind of flip-flops should I wear? Should I wear flip-flops? Should I put my baby on flip-flops? And here's the thing. Flip-flops are wonderful. You know, we don't get a lot of sun here in the Pacific Northwest. Let's soak it up. Let's
Right.
get all that vitamin D in. If you want to have your toes out, please do. But just know that sometimes, you know, places like there's certain stores that they have an annual sale on flip-flops every year. I'm not going to mention that store because they're not giving paid endorsements. I don't know. But they do an annual flip-flop. A lot of these flip-flops are very flat. They're cute. You can get
Mm,
all kinds of assortments, but also to realize that a lot of people are going to need some support for their arches because if you're wearing these all day, your feet get fatigued.
mm,
They get very tired. Some people will start to cramp in the arch because the
mm,
flip flop is so flat. Then also too, some people come home from being out and about with their beautiful flip flops on, and they notice their feet are dark and they're a little bit, you know, got some dirt on them and things like that.
mhm,
I
mhm.
also tell people, and this is for a lot of things. You know, here in the pandemic, there's a lot of Lysol now. So I tell people also too, a lot of bacteria and fungus and things can get on your flip flops. So little things that you can do to take care of your flip flops and make sure that
Mhm.
you're contributing to your overall foot health. A little bit of Lysol. Spray them with some
Mm.
Lysol. Put them in a plastic bag. Okay,
Huh.
just a regular store bag. Don't go out and buy a fancy bag. So people are
Okay.
like, oh, do I need to get bags from North? No, get a store bag. Wrap them up. Just wrap them around. Let them sit 24 hours. Take them out, go on with your life. And you don't need to do
Huh.
it every single day. You once a month. And a lot of times I tell people to do it with their running shoes, especially if they're prone to toenail fungus, if they're prone to athlete's foot. Because a lot of
Right.
times, I don't know about anybody else, but I will just jump in a pair of shoes and take out the trash really quick. If my son isn't available, I'll run
Mhm.
out to the car really quick, run to the grocery store. So just a little bit of Lysol. A lot of us have that lying around.
Right.
Just get that
Wow.
treated, let it saturate.
That's so I picked up a pearl. I like that. So the spray kind or even because I have Lysol wipes all over the house, right? Wiping it down with the wipes, is that fine too? Or is
That's
there
fine too.
okay.
That's fine too. Get in there. You know, because I think a lot of times when we're taking care of our home and our bodies, sometimes we forget the feet.
Mhm.
We
Mhm. That's
forget the
true.
feet. We're going to make
That's true.
sure that we're putting, if it's winter, gloves, hats, those get washed, those get sterilized. We don't think about our shoes. And sometimes we don't think
Mm.
about our socks. You know, some people, depending on where they're from or how they were raised, I have some patients who wear their socks over and over again as well.
With okay. Wow. Okay.
Mhm. Depending on where they
Wow.
grew up and how they grew up.
Sure.
Mhm.
Wow. So this is great. So along the lines of summertime and people's toes out and heels being out, I'll have people ask me, Doctor, my heels are super cracked, but I figure since I have you here,
Yes.
you are the foot expert, foot and ankle expert, all the things. Kind of, I usually tell people use carousel, right? Like do that
Mhm.
overnight. Can you give us a little pearl for cracked heels? Because we want the heels to look nice now that they're going to be out and showcased more.
I definitely
Yeah.
understand. So I have patients who have put their feet for the cracked heels. They have put them in Listerine. They've soaked them in Listerine because they think that's going to help. That's
Oh,
drying. It's very
okay.
drying. And I understand where they're coming from. They're like, oh, they're cracked from this. But sometimes, like I said, some of this cracking, most of the time we think it's just dry skin, just regular xerosis as it's called. But
Sure.
sometimes it could be a form of athlete's foot. Sometimes it's a form of some bacteria that's going on. So I do tell people sometimes you can start off, soak your feet in some Epsom salt. Okay, not any
Mm.
Listerine. Some
Mhm.
people have done
Mhm.
antifreeze, don't do that either. I had a patient who was doing vodka. Don't do that. It's a waste of good
Okay.
vodka. But just a nice, if you want to soak them in some warm water, if you're
Mhm.
diabetic, be careful. Feel it with your hand first.
Mhm.
And then get some Epsom salt in there, soak them a little bit, get them a little loose, and then take a pumice. Don't get aggressive. Don't get aggressive.
Mhm.
Just a light pumice. And then take them out. And you could put, there's all different kinds of lotions. I prefer Shea. There's lanolin, there's vitamin E. There is there's people who like petroleum jelly. I tell people that kind of gets macerated, but take something that's lubricating and put on a pair of socks. Sleep in
Right.
your socks.
Okay.
And then also too, if they're very big, I tell people to take some athletic tape, like when you go to the physical therapist and they put that tape
Mhm.
on your shoulder, on your
Right?
knee, take some of that and close that crack. And you can actually shower in that. A lot of people don't know that it's breathable because you
Okay.
have to think about the people wearing it on their shoulder for a week or
Right.
wearing it on their hip for a week. It's breathable. Let's close that down, especially if it's deep. We don't want to create ulcerations. So just take a
Wow.
piece of that, close it together, let it hold. Okay.
Uh-huh.
And when you come out of the shower, you can let it dry. Just let it dry.
And
Don't
then
just let it be wet and then go into your sock and your shoe,
got it.
but let it dry. And that will hold that together and act as a glue to bring that skin together. I've had it happen for patients.
Wow. So this is a new pro for me, Dr. Buckley. So cracked heels,
Mm-hmm.
the athletic tape, which you can get at Walgreens, right? And like do that for a few days and have that come together. So I was taking some notes here. The Epsom salt, love that. Shea, I got that in the house. You didn't mention carousel. What are your thoughts on carousel?
You know what? It works. It works for patients. I have seen people use it and it works well. And so I just usually try to tell people, because some people get very caught up in name brands. So I try to
Sure.
tell them things that sometimes they have at home, like coconut oil is a wonderful thing. Some people cook with it. Some people, they do all kinds, some people have it at home. So if they, I don't want to get, so carousel and all these kind of different products, sometimes I'll just say, you know what? Go get something that's emollient, because people get
Got
caught
it.
up in the names. Like they're like,
Sure.
oh, well, I have to know what product. And the
Sure.
reality is every product doesn't work for everybody. We're also wonderfully blessed and so different. So one thing that works for somebody else may not work for you, because you may
Got
have
it.
something different going on. You
Right.
may have a
Right.
little touch of athlete's foot going on there,
Yeah.
whereas they just literally just have dry skin. They're just dry everywhere. Or
Right.
they could have psoriasis.
Sure. Which you can't get anywhere, including the feet, right? So
Mm-hmm.
this is great. This is great. So thinking along the lines of, feet being out, folks are trying to go into the nail salon more often, get their feet done and all the
Yes.
things.
Yes.
Tips for going into the nail salon, some like basic things you should think about when choosing a nail tech, or things you should do before or not do, or yeah.
Yeah, that's a great question. Now, that is a great question. I get that a lot. I remember just a few years ago, there was a big push on antifungal nail polish. I don't know if you remember that,
Mm-hmm.
about
Mm-hmm.
4 or 5 years ago. And so when I get my nails done every 2 weeks. So what I look for, and I tell people just what I look for, I'm looking for the cleanliness. I'm looking for the things that I can't see. So when people so it's kind of like just observing people. Like I always watch the way people walk. People don't know that, but I watch the way that people are cleaning. So I'm looking
Sure.
at the way that they are taking care of the basin. Now, a lot of people are putting the plastic,
Right.
looks like a shower cap, but a lot of the fungus, people think it's in the bottom, in the basin. And a lot of people are going to clean that out. What it is, a lot of times, is in that. Have you seen the people take those drains off, on and off?
Mm-hmm.
Have you seen them
Mm-hmm.
clean those drains? They clean the inside. What
Okay.
do they do with the
Okay.
drain? They may rinse it in between,
Huh. Okay.
especially the ones that come off. And then also too, how are they taking care of their nail products? Are they actually coming out of a sterilized pack that's individual for you? Or are they being put inside of a UV light? They just did
Mm,
somebody's cuticles, okay? Did somebody's
right.
cuticles, put it inside of there. It's been sitting there for 4 minutes. Now they're using it on your cuticles.
Ew, okay. Yeah.
Also, too, how are they washing their hands in between, clients? I know these are little minute things, but these are the things that are, that you need to look out for. And you
Mhm.
can, if you feel like, all kinds of feet, all kinds of hands come into salons. So if you feel comfortable, you can bring your own. You can bring your own instruments. A lot of places will allow it if you talk
Mm.
to them about it, and you can actually store it there.
Oh, wow.
I, thank goodness, haven't had an issue, but I'm also very cautious. And I have switched salons when I feel like it hasn't been to my level of expectation.
Got it. Those are some great tips, Dr. Buckley, for sure. All right. So now let's get more into kind of some of the common things that we see as
Mhm.
far as foot issues. So we were just talking about that before we started recording. Ingrown toenails from kids to
Ingrown.
adults. It's a thing. So can we kind of talk about proper nail cutting, nail trimming care, and kind of ingrown toenails
Yes.
101?
Ingrown toenails those are so common. I'm trying to think. It's only, what is today? Wednesday. I think I've had 4 this week. Okay, of
Okay.
ingrown toenails. 4. It's only Wednesday. And so it's very common. And I always tell people to cut the nail evenly across, just evenly across. And I know that some people are prone to ingrowns. I've seen babies with ingrowns. If you look
Right.
on my Google page, you'll see a little baby standing in the basin of Epsom Epsom salt,
Mm.
his little feet in there, and he's so cute and he's so happy. But he was 3 months old and got ingrowns. And so, and I had a 3-year-old with ingrowns. So just cut it evenly across. And I know some parents, they have had ingrowns, so they want to help their children and they want to kind of get in there and, you know, cut to the side because they want to give them like that little slant because they don't want them to have ingrowns, but that's kind of ingrowing the nail.
Mm.
So let's just cut them evenly across. And that's what I tell everybody when I lecture, just cut them evenly across. Also too, there are some people who have foot fungus. And so sometimes the nails can be very, very thick like this. And so I tell people don't just cut and, you know, trim the end. Also too, if you can, when they're soft, kind of debride the top. Okay. So that that's not putting pressure on your nail bed and causing you pain when you're in your shoes. Okay, when you're outside of your flip flops, because summer season's coming up. And so that's not really gonna happen in your flip flops. But you know, if you're in your rain boots and things like that, let's cut the nails. Let's make sure they're even on the top and that they're cut evenly towards the top. So cut even across, cut down a little, you know, just kind of just buff it out on the top. So it's not so thick.
Got it.
Yeah,
And then
there's
okay to file down with the nail file too if it's hard to kind of, because some people have really thick nails. They don't have fungus. Some people, I'm one of those people, because I've gone to the podiatrist in the past. It's not fungus. It's just how your toenails are. My mom, literally, like my mom toenails are the same, and then my son. So I was like, we just have thicker toenails, you know. And then learning over the years, when I used to try to fight with it, get what I can, and then kind of file down with the nail file. That's okay to do.
That is perfect to do.
Okay.
And some people will go, and I've seen a lot of men who will get a Dremel tool. They're like, I'm a man, I'm, you know, strong, hear me roar, I've got tools in my shed. I'm just gonna shave down.
Okay.
One guy used to whittle it with a knife.
Oh.
I'm not saying that, just take your file and go just across. And also too, another good thing that I've noticed for some of my patients that don't have fungus, but their nail is kind of thick, tea tree oil.
Okay.
Tea tree oil. I love tea tree oil. Do not get it on your skin, as you know, because it can be a little bit caustic to the skin. But if you just put a little bit on the nail, rub it in, you know, after you're done filing, you can start to see some of those changes in the keratin of the nail.
Huh. So of course, putting in a carrier oil, right? Because you don't want to put it on straight. But over what period of time, Dr. Buckley, is like over?
Oh, it's not going to happen overnight.
Right.
Do not do this. Oh, it's not going to happen overnight. It's not. You know, just like when people say you didn't gain weight overnight, you know, same thing with the nails.
Right.
So give it time. Give it time. And like you said, most importantly, a carrier oil. You know, there's things that you can do to just, you know, there's other kind of things, coconut oil, there's other kind of carrier oils that will help. But I say put it directly on the nail. And if you're going to use your fingertip, you know, I tell people to wash their hands right away, but put it directly on the nail. It'll take you I would say, because the nails grow so, for some people, they grow in a short period of time, about 2 millimeters a day. Give it at least 6 months.
Got it. Now you just dropped the fact there I wasn't aware of. Nails grow for some people 2 millimeters a day. Fascinating.
Yeah. And like my nails grow very, very quick, but I know some people that don't. So yeah, we're just, like some people's hair grows very quickly. Some don't. Yeah.
Love it. All right. So kind of looking at another common condition. So flat feet and when to get orthotics and kind of, can we talk about that a little bit?
A lot of people have flat feet. It's very, very common. It's more common than high arch feet, you know. But people will come in, and I'd say if it's bothering you, there are people who are going to go on. I know that they used to not let people in the military for flat feet. They're no longer doing that, to my knowledge. But you know, if it's a problem for you, there are times where kids, I put kids in orthotics as young as 3. That's when you get your heel to toe gait. Most people get it at 3. Okay. Sometimes late 2s, but usually at 3. So then I tell people, if it's bothering you primarily, then get it evaluated. If it's keeping you from if you're getting cramps in your arch, if you are getting plantar fasciitis, a lot of people are getting plantar fasciitis. It's a huge, huge, huge issue that people come in with is plantar fasciitis. And so I tell people, if it's bothering you, get it fixed. You know, there's some people that have just very, very flat foot types, and they might benefit from a surgery as well, you know, when they're younger. But if it's bothering you, if you're noticing that you're loving it, you're a cyclist and you're like, this is just really bothering me. Get some orthotics, come get it evaluated. So I always tell people, if it's not bothering you, don't bother it. But if it's painful, come in and get evaluated.
Got it. Okay. I'm just looking. The time is going by so fast. I'm already thinking, Dr. Buckley, I'm going to have you come and do a part 2 another time, because I wanted to round out with footwear selection. So, starting off from the youngest age, a lot of people want to put their little babies in cute little baby shoes, because so cute little baby shoes, So when should we think about putting kids in shoes, and kind of speaking of that, and then things that change as you get older and have gait issues, kind of starting with the kids first to kind of keep it simple, kind of some parameters around that, when kids should be in shoes.
So everybody's different. Every culture is different. I have seen it culturally so different. Some cultures will say, we don't really want to keep our babies, shod or in shoes. So they will start sometimes as late as like 2. There's some people who are like, I'm gonna put my little baby in some shoes at like 2 months. I generally say when they're starting to walk, or when they're starting. A lot of people don't put their kids in walkers anymore, but if you're noticing that they're just really trying to use their feet, give them a little pair of shoes. Little pair of shoes. And then I know there was a hard push for hard bottoms. We've all seen those shoes. The harder bottoms are going to be great for, for orthopedic reasons and things like that. But it varies. It varies from person to person. I do say, do not put these babies in these heavy shoes. I see these wonderful Nikes. They're so cute. But why is your baby wearing a 3-pound shoe and they only weigh like 16 pounds themselves, and they're in these heavy shoes? And I know that they look good, but they're heavy. They're heavy. And then
but they're so cute, Dr. Buckley. They're so cute. I'm just
no. And then also watch what you're doing. Make sure they're not so heavy, especially if you have your child in one of those bouncy things and they're small and you've got them in their shoes. You are helping to create a toe gate because that baby's trying to reach the ground. So a lot of times we don't think about these things. It's putting our children in walkers and bouncers and things like that, and these heavy shoes. They're trying to reach the ground in these shoes. Like, hold off, put them in, have them in some socks. So as they get older, everybody's foot is different. There's no 2 feet. I have twin patients and their feet aren't even the same. So I tell people, get what is comfortable. Everybody's stuck on a brand. Everybody comes in like, should I have this brand? Should I wear Adidas? My uncle only wears Adidas. Or should I wear Nike? All of these different types of shoes. And I say, get what fits your feet. Get what's comfortable to you. Some of us have higher arches. Some of us have lower arches. Some of us have ingrown. Some of us, our feet turn this way, turn that way. All kinds of, get what fits you, especially as we get older. And then, as we get older and we want to wear, us ladies want to wear these cute shoes with these heels. Just think about your toe box. I always want people to have room for their toe box, because cramming your feet in these little itty bitty shoes can sometimes lead to problems later on down the road, especially if you have a family history of bunions, hammer toes, things like that. And then also too, unfortunately, as we age, our weight plays a factor in how our feet change. There is and also estrogen, just how we are with our hormone makeup. There are some women whose arches just start to collapse. And sometimes that posterior tibial tendon will start to just fall, and that arch is doing, now this foot is doing this. The arch is completely gone. The foot is rolling out. So there's a lot of things that happen as we age. And I've seen patients as they get older, they've got an underlapping toe, an overlapping toe. They've got toes on top of toes. Sometimes they're missing toes. So shoes are important, and we need to get ones that are comfortable and fit us well. Not what everybody else is doing, but what's going to work for us.
I love that. Individuals. And there was a term you use now twice, and I wanted to see if you could explain it for those watching. You mentioned the toe gate. Can you kind of elaborate what that means, so that everyone kind of gets a sense of what that means in layman's terms, if you don't mind?
Yeah. So there's different types of gates. So some people they're toe walkers. So they have a toe gate. And so that means that the heel is in the air, their toes are on the ground, and they kind of bounce like Tigger. And that's how they walk. And what that's doing is, a lot of times, and I've seen it in young babies, is where because they're trying to reach the ground so young, their posterior muscle groups get tight, and they get this toe gate where they're pushing on their toes. And sometimes their heels, as they age, don't touch the ground anymore.
Interesting. Okay.
Mhm.
So that's something that parents should be watching out for so they can come and see you to talk about that. Or I'm
There's
just trying to,
all kinds of things you can do,
okay.
especially the younger they are. If they're having an in-toe gait, like if you see them and they look pigeon-toed,
Mm-hmm.
they'll say, "Oh, my child looks pigeon-toed," or they're tripping over their feet like this. They can't run with the other kids.
Mm-hmm.
They're tripping over
Mm-hmm.
their feet, or their feet are out like this. They're splayed like ducks, or they're walking and they're bouncing and they're not. I can't get them to get on their heels. So
Mm-hmm.
what should I do? And those are the times where you want to put them in orthotics. Start that out because you don't really, because sometimes you may need to lengthen an Achilles. On a something that could have you tried to fix earlier. You don't
Mm-hmm.
really want to cut your child's tendon if you don't want to. Their Achilles tendon, it's the largest tendon. So if you can kind of see some of these things that are going on with your children, have them evaluated, get some orthotics. Let's try to correct it.
Got it. Okay. And then the last thing, and then we'll wrap up and let people know again where to find you is picking, now that it's nice out, people want to run outdoors, picking the right running shoes, and some like maybe 2 or 3 tips on how to go about doing that.
Oh gosh, for picking the right running shoe again, the fit for you. I
Okay.
have gone, and sometimes I'll go to for even for myself because I'm like, yeah, once I get these great shoes, I'm gonna run so fast. But yes, if you have questions, go in and go to these stores and try on different shoes. Don't I mean somebody may love New Balance, somebody else may love Brooks, that person may love Hoka. There's all different kinds of shoes that do different things. And Hokas are very bouncy. They're very bouncy. They're good. They're even across. So you have to see what's right for you. And I definitely go in and try on as many as you can. That's why the shoe stores are there. And sometimes they'll let you walk on a treadmill. Sometimes they'll let you run around the block.
Mhm.
See what feels good to you, and actually take them for a spin and take them. Get a feel for them. Make sure that the toe box, and the toe box is where your toes are. Okay.
Mhm. Mhm.
Make sure that you can spread your toes, lift your toes, because when you're running, what are you doing? You're not just, your toes are doing things. So we can't have them crammed into a shoe. There's some
Mm.
people with very narrow heels. So if you have a shoe that is extra wide all the way around and your heel is popping out, that's problematic for you.
Yeah.
So we have to make sure you get the right shoe for you. And I can't say there's a particular brand that I love because everybody's foot is so unique, like all of us. So try them out.
Love it. I like Brooks for everyone who's watching. I'm just gonna say, but that was a good tip. I never thought to went in the store to do that. Put your toes up because you're to make the motion your foot makes when you're actually running. So that's great.
Well, thank
Well, Dr. Buckley, I already know.
you.
I'm going to circle back and have you come back for another topic. Maybe it could be specific to diabetes, specific to something else.
Okay.
But we're gonna talk. This was wonderful. I
Thank you.
really appreciate your time. Again, you can find Dr. Buckley at Roke Up and Ankle Center, Centers with an S, in Renton. Can you let the people know kind of as far as insurance plans? Do you take
Mhm.
all insurance, or kind of speak to that a little bit?
Okay. Well, I'm in the IDC building in
Okay.
Renton near IKEA. I'm a block away from IKEA in the direction of South Center. So very centrally located, and hope to expand to other areas, hopefully in the near future.
Yeah.
But insurance plans, I take so many. I take most of the commercials, except for, it's easier to just say what I don't take.
Yes, that's fine.
I
Mhm.
do not take Kaiser.
Okay.
Unfortunately, I want to, but I don't right now. And I do not take Humana. I
Mhm.
get a lot of calls about Kaiser and Humana. Unfortunately,
Mhm.
I am not contracted with those insurances yet, but almost everything else that you can think of, I'm contracted with them. So
Love it. Love it. Thank you. Thank you. Thank you. This was great. I appreciate
thank you for
you. I'll
having
be in touch. Y'all go see Dr. Buckley. She clearly knows what she's talking about and then some. So
me.
until next time, bye everybody. Thank
Thank
you.
you.
Thank you.
Bye.